Hello, everybody. Welcome back to Paging America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. How's it going today, Dr. Rob?
It's going okay. Busy week for me. I think busy week for you. We've a lot of news out there with RFK Jr. testifying and the backlash from Casey Means, and Medicaid is still a thorn in the side of Republicans and Speaker Johnson, and the big beautiful bill is still out there. So yeah, there's a lot going on in the world that we're trying to talk about here.
It really is.
How's your week?
It felt like it came at me. It was a lot of news, and plus, the Committee to Protect Healthcare is busy right now, working on Medicaid, and so it was kind of a relentless week, to be honest.
Yeah.
It's beautiful weather in the city of Chicago, so the backdrop is at least nice.
Good. You can at least see people having fun, enjoying themselves out in the world.
That's right. You can watch from afar, people having a good time in Chicago.
That's good.
I will say, there is Chicago summers notoriously excellent in spite of the winters, and you can feel it. It's here, and the whole mood of the city has lifted.
Did you guys get any tornado alarms last night? Because we were hunkered in our basement for about an hour on the other side of the lake in West Michigan.
We did. The big news, not only was there tornado, I believe, warnings in Chicago, it postponed the Beyonce concert, which even if you weren't at the Beyonce concert, that's what the entire city was talking about.
That was the news.
That was the news. Essentially, everything stopped, and people were talking about Beyonce and worried that the concert was going to get canceled. So,
but thank goodness, concert happened a little bit late. Probably awesome, right? Yeah, there you go.
If you're in a city where Beyonce is going to come perform, it brings pretty much everything else to a stop, because it's quite an event.
Yeah. Well, good. Well, here we are at the end of the week, and glad we get a chance to talk about what's been going on.
Yeah, absolutely. So I think we're going to start off with one big, beautiful tax giveaway. Republicans are racing to push the legislation through the House before Memorial Day recess that begins at the end of next week, formally called One Big Beautiful Bill Act. I think none of us can believe that they've named it this. It's absurd. Some of the House Republicans, I don't know how they say some of this stuff with a straight face. Anyway,
how do they go home and look at their families and
I don't know.
Taken seriously, let alone their constituents, right? But they don't seem to care about that. They don't face their constituents. But I assume they still have to talk to their children and their spouses or whoever they have.
Right. You gotta hear the great name we have.
Yeah. Maybe they think it's great. Maybe they think this is freaking awesome.
Okay. It's ridiculous. Ways and Means, after a marathon 17+ hour session, the Ways and Means Committee approved tax giveaways to corporations and the super wealthy that would add $3.8 trillion to the federal deficit over the next 10 years. Many of the tax reductions that would benefit non-wealthy people will expire quickly. Those that benefit the rich would be permanent.
This is the fiscally conservative group, right? Who's pushing this through?
Yeah,
that's great.
I think that's.
That's gone.
Still gone. That's gone.
Okay.
We're not there anymore.
That's so like my teenage years, 80s, right? Yeah.
That's
God.
Early 2000s politics, and it's out the window. For context for all this, we're talking about the various committees that the bill has to go through. In agriculture is considering major cuts to food assistance programs like SNAP. The Washington Post reports that includes a provision that starting in 2028, all states would have to pay at least 5% of their SNAP benefit allotments. Additionally, states would be required to immediately begin paying 75% of administrative costs. States pay half the program's overhead now and do not contribute to benefits. I know we're here talking about healthcare, Rob, and we're going to get into the implications for Medicaid and health policy here, but SNAP and childhood nutrition plays a big role in health outcomes, right? How does that play out in sort of your practice, or how you practice medicine?
Well, just how you think about health, right? We talk to people about, diet and exercise. We talk to them about getting out and touching grass, getting fresh air, eating, fruits and veggies, and eating a well-balanced diet. And that's what the SNAP program does. It allows that for lower income folks, and particularly for kids. Right? Kids, they can't be their healthiest without. They can't go and learn their best and do their best, in school. And so that's literally what they're saying. We're willing to do this to incur a massive deficit and give tax breaks to billionaires, right? We've been talking about cutting Medicaid for tax-based billionaires. Well, apparently they're not stopping there. They want to hurt poor and working folks in any ways they can by taking away their health care and by taking away their food, apparently. So, and this committee did pass it through, right? So they are fine with it. And it's not even being talked about that much. So apparently it hasn't even gotten the attention of the press, in the wider sense, or activists in a big way, like the Medicaid stuff has. But it's massive. It's huge, and it's gross. It's just awful.
I think that, it's interesting with food assistance. I think it doesn't get headlines because Republicans have always kind of made food assistance a red herring, like pretending that it's a bigger part of the budget than it actually is, pretending that you can sort of like do anything to it, and that would like save money. Like it's just such a minuscule amount of the overall budget picture, and like when placed next to the enormity of the tax cuts that are coming, the fiscal problems that causes, it strikes me that it's just a bit silly, and it's like obviously cruel, right? Because states are going to have to make hard choices, and certainly there would be plenty of states that would not make a choice to fill in the gap.
Right. Either you cut more people off of it, or you fund it and you cut something else, right? Some people are going to lose services. And probably the easiest thing for states to do is say, well, the program got cut, scale back, we're going to have to cut back, Even well-intentioned states that have to balance their budget, they can't run $3.8 trillion deficits or debt. Yeah, that's cruel. It definitely works within health and definitely needs to be talked about. And a number of calls I've been on with advocates, health advocates and others have urged us to talk about SNAP, talk about food assistance, because it just doesn't get the amount of press it needs to get. So hopefully people can be out there talking about this just as much as they're talking about healthcare.
Yeah. Okay, so on to energy and commerce. Energy and commerce is considering a proposal to cut Medicaid by $715 billion and would reduce the overall budget deficit by $912 billion over the next 10 years. It would also throw 8.6 million Americans off their health insurance. So the contours of what they're trying to do now are clearer. And we're talking about millions and millions and millions of people getting thrown off the Medicaid rolls. It's bad. It would be bad if it goes forward. Unsurprisingly, the proposed legislation would benefit high-income families the most, likely lead to hospitals closing around the country. So pretty bad in places. It looks like, if the bill goes through, there will be hospital deserts. There's also
and it's not just hospitals. This is a really important point, right? Like smaller community hospitals, they support the entire health infrastructure of the entire community. So labs, x-rays, people getting mammograms, people getting their screening colonoscopies, people being able to go see a family doctor for a routine visit or to manage their diabetes or their hypertension. All of these things end up going away because about a third of a lot of these populations are on Medicaid. If you cut a significant chunk of that, a significant chunk of the revenues for this entire system go away. And particularly rural hospitals, but really all hospitals, but particularly rural hospitals, they run on razor thin margins. Like we're talking like 1-2%. And so a little bit the wrong way and they can't make the books work, right? They're already nonprofit or not for profit. They're already benefiting that way. And so it's real damage, again, not just to a hospital, because some people don't go to the hospital, right? Like most people probably don't go to a hospital on a regular basis. They definitely go to their doctor. They, women definitely get mammograms. People over 45 should be getting colonoscopies every 5 years. And so this will not just, again, impact Medicaid recipients. It will impact every single person in those communities driving 2-3 hours to get any of these services, or in a lot of cases, just skipping them all together, right? They'll have worse health and worse outcomes, and literally more people will die. Just can't state it enough that is the real consequence of this. Millions of people sounds big. It is huge, but legitimately lives will be lost.
Yeah. And the sort of ripple effects into the health system more broadly. So one dynamic that's playing out in the Medicaid fight is that there is a push to expand Medicaid work requirements. Now, for folks who are not familiar with work requirements, like 64% of people on Medicaid already work. And then vast majority of the remainder of folks have some reason why they can't work. That's why we have Medicaid, right?
Yeah, nearly 95% of people either work or they're taking care of children or an elderly loved one, or they're disabled, or they're over 65 and they're also on Medicare. They're just extremely poor, so they qualify for Medicaid. So nearly 95% of people are in that big bucket of folks that absolutely qualify, and even the most callous of individuals in Congress could agree, that person probably, in their terms, right, deserves healthcare funded through this program.
So the So this is the fight that's happening inside of the GOP caucus. So this is we're not having this fight. It's totally an internal Republican fight. But the enhanced work requirements would push millions of Americans off the program. But some of like the more conservative of the already very conservative members are mad that the work requirements wouldn't kick in until 2029. That they would. I'm not sure if they just want to kick in right away.
Right.
But yeah.
So that and that's is that the budget, right? The budget committee also this went through the budget committee, and I believe that's the committee where all the Democrats voted against, right? This great big beautiful bill, or one big beautiful bill, or whatever the hell they call it. And I think 5 Republicans joined them. And at first I saw that and I'm like, hey, it's working. Like the pressure, these guys are caving.
Yeah.
That's not it, right? Is that like what is the real? Who are these Republicans who are caving, so to speak?
These are extremely arch conservatives. They would like steeper cuts. They would like more cuts. They're like what we used to call like fiscal hawks. I guess these guys are still fiscal hawks, and so they want to bring down the debt and the deficit. I mean, like that's what they're saying, but they're sort of like they're kind of willing to do anything to do it. One way to do that would not have the tax cuts in there.
There you go.
Do it.
Yeah.
But that's not there.
Well, Trump has floated another tax bracket for people making over, 12 million, 10, I don't know. It wouldn't be that many people because most of the people making that much money aren't getting income. They're getting dividends and all that. But he's even floated that. And I think the reporting is the response is, yeah, that's not happening. Nope, we're not going to do that.
And the I've heard that really high income that really high tax bracket described as a like actors, actresses, and professional athletes tax because they're only
because they have income that is
because they have income and make that much money, and that's kind of the only class of people that actually do that. Anyone who's making millions of dollars usually is doing it from capital gains or they have a business or something like that.
Boy, you think Johnson would be chomping at the bit, and they could call it the Hollywood liberal tax. They could really go with it. Actually, Trump called Bruce Springsteen, one of my heroes of music and culture, called him a Hollywood liberal today. I think he lives in New Jersey. So that's an aside. But, just another thing our president got wrong and is spending his time doing when he hopped off of his flight to the Emirates talking about his new jet. But that's another story. So, these fiscal hawks, supposedly, or these ultra conservatives who are not caving to pressure from constituents or from patients or from doctors or, all of that. They want to extract more from the poor people, from working people, so they can keep those tax cuts for the billionaires, right? And then maybe not have as much of an impact. It's still not going to be neutral on the deficit. They're still going to drive up massive deficits, right? Add to the debt in a huge way. So where do we go next, Miles? We're recording this on a Friday. Next week, things on the horizon?
Yeah, so they're gonna try to hammer out a deal over the weekend. I suspect they'll get there. It's not the fiscal hawks or the arch conservatives that are going to stop this. It would be the so-called moderate Republicans. I don't really think of them as moderate so much as I think of them as people who are clear-eyed about whether they can lose their seat or not.
Yeah.
That those folks are going to be those are the pressure from that small group of Republican GOP members would be the thing that could possibly change the course here. We could see a vote. I don't see it happening any earlier than Thursday, but things change each day. So,
and that's a good point. I think more people need to point that out, right? These aren't people who actually have moderate views on this. These are people who are afraid of losing an election in 2026. So they're vulnerable Republicans. They're not moderate Republicans.
They're not moderate
because there are some Republicans more in the Senate. Maybe they're not moderates who have expressed real concern about cutting Medicaid. Josh Hawley has done this for reasons of the fact that the state of Missouri may go into bankruptcy, right? Because they have to. They have to cover the expanded Medicaid universe. So if the federal government starts cutting all these people, they got to pony up, and they don't know where that money's coming from. I think that the new senator, I forget his name, from Utah, there's maybe some talk that he has expressed actual concerns about actually taking healthcare away from people. We want to give a little bit of credit for folks that are legitimately being concerned about either state budgets, which is a big deal, or actual humans losing healthcare. This is not who Mike Lawler and that whole crowd of these vulnerable House members, it's not where they're coming from, it doesn't seem.
We've been saying on this show that pressure on the pressure on the moderate or the vulnerable Republicans across the country seems like it's been working. So now they have to go work with the fiscal hawks and the ultra right of the GOP caucus over the weekend. We'll see what sort of the reaction is then from the moderates and the vulnerable GOP on where the Medicaid components of the very ugly bill go.
And they can only lose, how many Republicans can they lose on this vote to get it through? This is like a majority vote in the House. Was it 3, 2 or 3?
It's not. I believe
Razor thin.
depends. It depends on who shows up that day.
Yeah. So the key is keep up the pressure, right? For advocates who are listening, both physicians, non-physicians, we work with physicians primarily, getting those voices out, getting the stories out. Keep up the pressure and do it in those places where there are vulnerable Republicans who are afraid of no longer. I just don't get it. They named the bill after this weird thing Trump said, big, beautiful bill. They have to capitulate to every one of his whims and needs. Why do they even want to be there? Like they work so hard bending themselves into pretzels to maintain a seat supposedly of some level of power and control when they've given up all of their power and control to Trump and his goons. It doesn't make sense.
It doesn't make sense to me. One, running for Congress is not fun.
No.
You know.
I know.
We need people to run for Congress, but it's not a fun project.
No.
Anybody who's interested in running for office, there are lots of offices to run for that are fun to run for, I think, where you can go out and you can make a difference and have a good time. Running for Congress is not one of those offices. It's very difficult. When people do it because they want to do true public service, the more power to them, and I'll root you on. For those folks who just want to sit there and be a rubber stamp for the White House, especially to take healthcare away from people, to give tax breaks to like their buddies. That is I just cannot understand that project in the least. Like I don't understand the motivation. Maybe they just like going to Washington D.C. I don't know.
They like wearing the pin and they like the fast track through TSA. Like maybe that's it.
Maybe.
You get a pen and you get through
just
TSA quick.
That's enough.
Don't have to pay for clear. So there you go. This is their fast track. Yeah. Anyway. All right. Keep up the pressure.
Yeah.
Right. That's our only path.
Yeah. All right. So we got something from Robert Kennedy Jr. that we agree with. Rob, and why don't we throw to the clip?
I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Okay. So we know that was RFK Jr., right? We can tell by his voice. And he said, I don't think people should be taking medical advice from me.
We agree with them. And
Thumbs up. I don't have the little reactions on. I wish I did. We'd see a big bubble with a thumb.
So RFK, where this came up, RFK Jr. faced back-to-back congressional hearings on Wednesday in a House Appropriations Subcommittee and the Senate Health Committee. Fun fact, Ben Cohen of Ben & Jerry's fame was arrested at one of them. I don't know if you saw that.
Love that. Yeah. I did. I saw people getting arrested, and then it was Ben & Jerry's. It makes me want to go get a chubby hubby.
Pint. Grab a pint.
Yeah.
That's funny.
Yeah, for sure.
So he had all sorts of wild quotes during this thing. I mean, when this guy cuts loose, when he's like in these congressional hearings and he's just letting people know what he thinks, it gets about as weird as it can get. I mean, it's really something. So when asked if he would vax his own kids against measles, he said probably.
Right, probably. Not absolutely, yes, 100% deadly disease, making a resurgence, safe, effective vaccine with lifelong immunity. All these things are true. His answer is, probably.
When asked if he would promote the measles vaccine, he said, I am not just going to tell people everything is safe and effective if I know there's issues. So, and then this is for the MPHs, for the handful of MPHs that listen.
Okay.
When defending his cuts at HHS, he said, an exploding debt is a social determinant of health. So,
oh my God. The only time he's ever uttered those words and pretended like it actually was something that he was concerned about.
Yes, that's right.
Yeah.
So, for all the MPHs listening, social determinants of health now includes the national debt.
The national debt, the social determinant of health. So go ahead.
But one more, because I'd like to get your reaction to this. In Europe, they don't use the chickenpox vaccine specifically. So he said that to Congress. 28 European countries use the chickenpox vaccine.
So is there one that doesn't maybe, and he was focusing on that one? I don't know. I didn't do that research. I don't think we need to. He's lying. He's an ass. He's lying. He's just lying. Making shit up.
But you used to not be able to lie to Congress. I mean, I was there would be blatant lying to Congress. I guess I don't understand. Sometimes when he says some of the medical stuff, we know he's lying, and it's for political power, and there's sort of a straight line to profit. Sometimes when he says this stuff, I think maybe he believes that. Like with this one, with the chickenpox vaccine in Europe, I'm like, maybe he just thinks that. That's true.
Why would he? Why would he just make that up to make a point when it's demonstrably false and provably false in like a quick Google search?
Yeah, it's just so specific. Yeah, that I was like, how did that possibly beam into your brain?
Well, I mean, we know there's a brainworm that he got at some point, right? We don't know where he got it. He maybe got it from pork. And then we know he's been swimming in Rock Creek. And if you look at the signs, they say don't swim there because of bacteria. Maybe there's certain amoeba that are freshwater amoeba that can burrow into your brain. Like, I don't know, man. This guy does a lot of weird things, a lot of risky things. You know, who knows how those things get into his brain. But again, he did say one thing that absolutely resonated, is that people should not be taking medical advice. And again, we can all agree about that. The problem is people should be able to take medical advice from the Secretary of HHS, right? The point of the existence of that agency is both to administer Medicare, Medicaid, the FDA, right? Testing, all that. But it's also got the CDC. It's also got the NIH. It's also got, the Surgeon General's office under it. This is where we get our medical advice, right? This is where we all get the charge from the federal government to tell us these are the things we should be recommending people do. And so if we can't trust medical advice from him, who does he suggest? Do we just go to Uncle Joe on Facebook, or the guy you graduated with who has an opinion? Like that seems where they get theirs, and he gets his information.
Casey Means. He wants you to get your medical advice.
Wants you to get it from Casey Means. So then we're going back to praying to the trees, getting your woo. I don't remember what that was. Getting your woo. A thing that was reminded on it. Go ahead.
Oh, it's woo woo. Yeah.
Woo woo. Oh, sorry. Okay. Yeah. And then again, all great. Don't want to denigrate anyone who is into all that, but like, you shouldn't be the Surgeon General. It was, she talked about good energy, bad energy. And I was being interviewed, and the person brought up good humors and bad humors, right? This was the concept that disease arose from humors in the body. And that's what, they bloodlet, they drain these bad humors from your body to try to cure you of diseases. And again, people were dropping like flies back then.
Was that with leeches?
Well, leeches are another thing, but like literal bloodlet, right? There are a few conditions where you do bloodlet. Yeah, you stick a needle in and you drain the blood out of people to drain the bad humors. Sure. That's what we're doing. We're going back to the 1800s, except now we've got a potential Surgeon General who's got a big old grift. And the snake oil salesmen, they used to go town to town. They could just pop it up on the internet, right? Put it out on Instagram, and they've got their grift going in all 50 states and who knows where else. Yeah. I mean, I think that's where we get to eventually on all of this, right? These folks have profited and intend to continue to profit off all this wackadoo science that they've been selling to people. And again, I'm against it. We should regulate it, but I care less about it if they're just doing it on their free time and not actually hurting anyone. It's when they want to take the reins of government. And it's, it's RFK. Yeah, it's one thing that he doesn't understand medicine, right? I wouldn't expect him to. He shouldn't have been in that job. We advocated against that way back. Again, it's a point that he's profited off all this, and now he's in charge of an agency that he doesn't even understand. I mean, he told us he didn't know what Medicare and Medicaid, how they worked way back then, and now we're supposed to trust him. I think the other thing that popped up related to Kennedy is the Trump executive order. I don't know if you're going to bring it up, but I have to bring it up because it got so many headlines telling people, look, he's lowering drug prices, creating most favored nation status, telling Bobby Kennedy that he needs to tell Big Pharma, we will not pay more than all these people within 30 days. And the problem is he issued an executive order extending the patent for pills, certain type of biologic pills for Big Pharma that they've been pushing for years, essentially increasing their profits. And these EOs are just like we said before, they're just press releases, right? They're just ways to grab headlines, and they have no teeth. It's an agency that they're like, out of any of the cabinet secretaries that we've seen, maybe Pete Hegseth, he's gotten himself in hot water for Signal and his crazy stuff, but like Bobby Kennedy has been given so much deference and has the potential to do so much damage. And it's just so plain bizarre. It's hard to understand where all that power came from, except you talked about it before, his coalition that is important in their electoral math and how to stay in power.
Yeah. So Rob, I'm going to just give you a quick quote from President Trump on his prescription drug EO. He says that prescription drug and pharmaceutical prices will be reduced almost immediately by 30 to 80%. They will rise throughout the world in order to equalize and, for the first time in many years, bring fairness to America. I have a thought about this because this is, since like Obama era, prescription drugs have always been a problem, but since Obama era, they became like a bigger problem, and their price just kept going up and up. And it is like true that the American market subsidizes a lot of the rest of the world market for prescription drugs, right? Both R&D and then, and that's like a lot of American
It
academia,
subsidizes the profits of pharma, though, right? Like they have such exorbitant profits. But yeah, go ahead.
Totally.
We do.
But the American market sort of subsidizes the project of developing new drugs and then the cost of other drugs. And so saying that by establishing this, quote, most favored nations policy that will bring it down, I bet everything I own that prescription drug and pharmaceutical prices will not be reduced immediately 30 to 80%. Right. It's a preposterous thing to say out loud. Yeah. But also it's just an EO to go do some extraordinary thing inside the prescription drug market. One, it could be really extremely disruptive if you were able to do it. But two, so like, remember what the Biden administration did is they went through a legislative process. Right. They got votes in both the House and the Senate in order to enable Medicare to be able to negotiate rates on prescription drug prices. And so, the legislative body was involved in that, and then the White House was involved in that, and then the agencies were going to go execute on it. And that's not what this is. No. This is somewhere between what did Donald Trump call? Donald Trump called it Soviet-style price setting back in the
when they were trying to limit the increase in grocery prices, right?
But yes, when they were trying to limit grocery. So he said that's Soviet-style price setting during the campaigns, and now we're doing what I think he thinks is we're doing what is essentially Soviet-style price setting.
Yeah.
Now, it's a worthy goal. I think this is probably this is an absurd effort to do it. I don't think it's going to work. I don't even think they're really trying. I think they're just communicating about it to get
for sure
political
it's headlines
points or whatever.
Headlines. I mean, we've worked for, and the Committee for Healthcare worked for prescription drug affordability boards in states. Fully support it. These are experts in the fields of medicine, in the fields of economics and health policy, with advisement from all stakeholders in the process. And they are then bringing pharma to the table, and they're trying to say, hey, explain why this drug costs people in, say, Colorado or Minnesota or Maryland, why this drug costs so much. Can you justify it? And if they can they've done it in Colorado, they actually considered a few drugs and said, no, we're not going to actually regulate that price because they showed us the books. They proved to us, okay, there are reasonable ways people can get this drug more affordably, and there's a reason it costs this much. And then for a few other drugs, they looked at it and said, yeah, you can't justify that. You've recouped all of your R&D money. You've made plenty of profit, and that just doesn't make sense. But it's a process, and sometimes that process is too damn slow. Like we believe, I would love it if someone could wave a wand and everybody had affordable health care. Like if you could issue an EO that says everybody can afford health care, and it was like this little magic wand that did it. Oh my gosh, that would be a great thing, right? That's not reality, right? That isn't how it works. He tried to do this in 2017, and then pharma went to court, and it got thrown out because he can't just do that. It's not thought out. It goes along. I mean, it kind of is his MO, right? He just gets an idea, and maybe, I don't know if he even knew this was coming. I always see them reading them out to him. So you just question, like, someone decided this would be a good headline, so we'll just have a little signing ceremony and put it out there. My concern then is that the media, they bite. I'm not here, this is not a bashing the media podcast, but they do bite on it. And the headlines are all that he is doing this work. And it's like, no, he's not. He just signed a piece of paper. And like, let's see a month from now where the prices are. He also is suggesting that other countries will immediately pay more. I don't know that the fine citizens of Denmark are going to just go out and start paying more for their drugs immediately because Donald Trump said that's what they had to do. Like he has less power over those folks, So I think it accomplishes nothing. It's a headline grab, and it'll be gone by next week, and everyone will forget about it.
We're gonna follow this because I think,
for sure.
I think him not getting points on prescription drugs. For context for listeners, like prescription drugs and prescription drug prices and bringing those down is one of the most politically popular things you could do in America because it is one of the biggest problems in America. Being able to afford your prescription drugs is an extraordinary burden for a huge swath of the country.
Yeah.
And people often have to make hard choices, and then sometimes will make choices that do not include taking their prescription drugs, which leads to long-term health problems, right?
Yeah.
That are treatable, that would have been treatable, and it's an issue of preventative care. This is something we're going to follow. Don't give Donald Trump points. He didn't lower prescription drug prices, and we're gonna follow and see how they go for it, and see if the courts sort of intervene again, or see if I could see Bobby Kennedy just doing something very strange and trying to take credit for it and having it sort of become a big nothing burger.
Yeah, I mean, I think, listen, Medicaid has been, this is our fifth episode, and I think we're kind of digging this. Seems like Medicaid is going to be popping up a lot. I know you've coined the term. Maybe you heard it somewhere. Maybe you coined it, hot Medicaid summer, but it is.
That's why.
Yeah, that's you. I mean, I think a trademark, we're going to do a verbal trademark. If Donald Trump could declassify documents by thinking about it, we can trademark that phrase just by saying it, right?
Yeah,
so
that's
trademark, hot Medicaid summer. It's getting hotter, right? It's in the 80s here. You're getting into summer in Chicago. I don't think that this issue's going away. They're not going to be able to solve this thing quickly. If it gets out of the House, it's got to go to the Senate. It is not going to pass the Senate as is. I mean, this is a mess that they're going to have a hard time getting out of, because they shouldn't be here. They shouldn't be dabbling in people's health care to pay for tax cuts. So we're going to have to continue to stay at it. And so if it feels like this is the Medicaid podcast, for a few months, it just may be that, because this is so damn important to the patients we all serve, the docs who are listening who know, and the advocates who are listening. And so I think we just have to keep bringing this up, and we have to keep on the pressure. But other than that, I think we've taken care of the news for the week. So if you would be so kind as to read us out, I think that'd be great.
Yeah, that's great. All right. So today's episode was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. It was produced by Amelia Dillon Schneider, Aslan Ibrahim, and Joel Bryson. Music by Annette Somerset at Duneflower Productions. If you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, Apple Podcasts, or wherever you listen. Your support helps others discover the podcast.